Can you see yourself working for somebody else?
I never have.
Can you see it?
I'm used to having a company where the ideas that I have are something that I can easily pursue. So I think it'd be a tough transition.
If you had stayed at Harvard a few more years, would this computer revolution have passed you by?
Perhaps. Things move very quickly in the industry, and it was really the urgency to get out there and be the first one to put a basic on the microcomputer that caused me to drop out.
You're called a genius, and well, no, I don't think that embarrassed you at all. They call you a genius. Part of your genius is that you are a computer whiz, and the other is that you did have the business acumen to turn it into a working company. Are you a business genius too?
Well, I wouldn't say genius. I enjoy working with the people, talking about what we're going to get done, getting real excited, making sure that the structure is there, that the ideas get measured properly, and really leading the company. That's exciting.
Big bombs. Please welcome Mr. Bill Gates.
We also face a new threat that the next epidemic has a good chance of originating on a computer screen of a terrorist intent on using genetic engineering to create a synthetic version of the smallpox virus or a contagious and highly deadly strain of flu. So the point is that we ignore the strong link between health security and international security at our peril. Whether it occurs by the quirk of nature or at the hand of a terrorist, epidemiologists show through their models that a respiratory spread pathogen would kill more than 30 million people in less than a year. And there is a reasonable probability of that taking place in the years ahead. This is also where we see many epidemics starting. For example, Ebola.
Of all the things that are out there, what could cause an excess in a single year of 10 million deaths? Now, clearly a big war could, and a pandemic, natural or created by bioterror. The natural pandemic, the last gigantic one, was 100 years ago. We are healthier today, but the speed of travel, and therefore the speed of global spread, that works against us. But in some ways, the bioterror thing scares me the most. All it takes is one small terrorism group. Those groups have used things like anthrax that are non-human to human transmissible, and as yet, thank goodness, they've never been able to build or get their hands on a nuclear weapon.
Are you nervous about your own life and
No.
what could happen?
This thing will get a lot of countries before it gets to the U.S., but even the U.S. has to think about its global health security. It's a government thing to decide, okay, this is a problem, how do you move resources around, how do you allocate the scarce supplies? When an epidemic hits, governments having been prepared in advance and going through simulations, that will help them make the decisions that are only in their hands.